Understanding the difference between panic attacks and anxiety attacks, causes, symptoms, and treatment options. Anxiety and panic disorders are complex conditions that can significantly impact an individual's quality of life. Fortunately, there have been numerous studies conducted on these disorders that have provided valuable insights into their causes, symptoms, and treatment options. One study that has been particularly informative is a meta-analysis that looked at the effectiveness of cognitive behavioral therapy, CBT, for panic disorder. This study found that CBT was highly effective in reducing panic disorder symptoms, with remission rates ranging from 33% to 87%. CBT interventions that focused on panic symptoms and avoidance behaviors were found to be the most effective. Another study that is worth noting is a meta-analysis that explored the relationship between childhood adversity and panic disorder. This study found that childhood adversity, such as physical or sexual abuse, neglect, or parental separation, was associated with an increased risk of developing panic disorder in adulthood. The review also found that childhood adversity was associated with increased severity of panic disorder symptoms. Genetics also play a significant role in the development of panic disorder, as shown by a meta-analysis that explored the impact of genetics on panic disorder. This study found that variations in genes related to the stress response, neurotransmitter systems, and brain structure were all associated with an increased risk of developing panic disorder. It is also worth noting that comorbid disorders, such as depression or substance use disorders, can significantly impact treatment outcomes for panic disorder, as shown by a meta-analysis that explored the impact of comorbid disorders on treatment outcomes. This study found that patients with comorbid disorders were less likely to achieve remission from panic disorder symptoms, and more likely to experience relapse. Fortunately, there are several effective treatment options for individuals with panic and anxiety disorders. Cognitive behavioral therapy, CBT, has been found to be particularly effective in treating these conditions, as it helps individuals identify their negative thought patterns and develop coping strategies for managing their anxiety or panic attacks. Psychodynamic psychotherapy is another treatment option that focuses on exploring the underlying psychological conflicts and issues that may be contributing to an individual's anxiety or panic attacks. In addition to therapy, seeking help from a qualified mental health professional can be an important step in managing panic and anxiety. These professionals can provide individualized support and guidance, and may also be able to prescribe medication if necessary. In conclusion, while panic attacks and anxiety attacks can be overwhelming, it's important to remember that both are treatable conditions. Seeking help from a mental health professional and engaging in therapy can make a significant difference in managing and overcoming these conditions.